Another way to harvest particulate, if we're going to use GBR, is using the ACM, or the auto chip maker from Neobiotech. And you can see this is another case that I was treating with, this is going to be GBR, and I can harvest a tremendous amount of autogenous bone utilizing the ACM. And you can see that one of the nice things about this unit is that with only a very, very small depth penetration, 4 millimeters, and on low RPM, I'm able to harvest a very nice amount of autogenous bone that's already in the size dimension that I can use for my graft site. So very effective in the manner in which it can be harvested. Very nice technique, low RPM, 250 to 450 RPM is about what I use. You can see this is vital bone that's maintained in the chamber. I can remove it from the chamber. I can mix it. You can see this is 15 millimeters of bone. I mix it with the PRGF from the patient's own blood. So I add autogenous bone with an autologous bioactive modifier. And now if I want dense bone, I go to the cortical bone of the ascending ramus with the same drill. You can see how dense the bone is. And this is now a different quality of bone. It's very white, not as much blood. This bone is very dense, and it's a different quality of bone for our graft. This is what we would consider a low turnover bone product. And here, removing the sleeve, and you can see tremendous amount of shaved bone from the ACM. So I'm a big fan of this, again, having been introduced to it by Dr. Ho, and I use this routinely in my practice for GBR cases. And again, mixing it with PRGF. The PRGF has fibrin in it, it's sticky, and it allows us to use it as a carrier. I can then take it to the area of the vertical and horizontal defect in the posterior, and you can see it's already pre-chipped in the size that I need, and then I can use it as part of my bone graft.